I'm Dr. Rich Lerner, and today, seniors, I'm talking to you. I'd say the number one thing that I get from patients as they come into the office about why they think that they're feeling what they are, having the health issues that they are, they tell me it's their age. And especially in that senior group, they just come in almost because you've been taught this, that as you get older, you're just supposed to get sicker and you're just supposed to have all of these different health problems going on, that it's just because you've gotten to that particular age. But I can tell you that I have people in their 20s that come in and say, well, I'm getting older and that's why my back's starting to hurt. I have people in their 30s, their 40s, and their 70s. You just all the way up, everyone thinks their age is the cause of their problem. What we find is it has nothing to do with age, because I could find people your same exact age that don't have any of the things going on that you have going on. I have people in their 20s that have arthritis in their spine. My oldest patient I ever had here was 93, not a drop of arthritis in their spine. So it doesn't really have anything to do with age. It's all about how your body has been working and functioning and how the structure of it has been set up for your life that determines the health outcomes that you're having now. And so what we really look at here is, how is the spine set up? There's a specific shape that your spine's supposed to have, and if you don't have that shape, that's where the breakdown problems start. It actually creates a degeneration process in your body. And so what comes along with that over time is, one, you're going to start losing range of motion. So all of that stiffness and that lack of movement that you have isn't because you're 50 years old or 60 years old or 70 years old. It's because your spine isn't in the right position and giving you the wrong structure. And so things have been breaking down. And what we see a lot of times, it's been for decades and you didn't even know it was going on. Why those aches and pains start to creep in, it's the same thing. The more degeneration you have, the more pressure there is going to be on your spinal cord, onto your nerves, and that over time is going to create aches and pains. Those health things like digestive problems or blood pressure issues or any of those other things that creep up over time, they don't happen overnight. It's problems that have been there for a long time, and eventually you start to feel them and then they get worse. When we look at what the root cause of them that's been going on, it's something that started years and years and years back. And so, as much as we blame all these things for age on seniors, that's why we also take care of a lot of babies in our office and little kids, is that so we don't get those same health outcomes as we grow up, that your parents had. And so that's one of the big things, for me, as I started doing this, because heart disease was, killing all the Lerner males at early ages. And so we said, my brothers and I said to ourselves, we better start doing something different so that we can create a different outcome as we start to get into those same age groups, so that we don't end up dying early of heart disease. And so you're sitting there now and you're like, I can't move, and things are killing me, and all of these things are going wrong. Well, I can tell you, if you start getting your body working better, if you start setting that structure up into a better positioning, your body can heal. That's the amazing thing about the way that God designed us, is that if we just allow our bodies to work better, no matter what's going on, you have the ability to start the healing process. And what that can do for everybody is obviously dependent on how much damage is there. So the earlier you start to take care of this, the better. And so if you're sitting there and you're like, but all of my friends, they have low back pain, I must have to have low back pain, I can tell you right now that there's people your age that don't have it. And I have lots of them that come here, and they didn't come here like that, but they are pain-free now because of the way that they've started to take care of themselves, and they're just starting to see other health benefits come along the longer that they do it. And so it's just an important thing to get checked if you've never had that done.